1930s and 1940s. Wouldn't say it was way better, but the psychologists started realizing that there is something called as mental illness which can be cured. Like, wow, which can be cured. So they started doing lobotomy. Trust me, now if you get to know what lobotomy is, you are going to get shocked what it is, but it is very interesting. This lobotomy was very common and applied in 1930s and 1940s, where it was treated on the people who had problem mental illnesses like severe depression, anxiety, schizophrenia, and so on. So what exactly is this lobotomy? So this lobotomy is a surgical procedure that was used to sever the connections between the frontal lobe of the brain and thalamus. It was very popular in 1930s and went on till 1950s. This was taken as a treatment for those people who did not react to any other treatment for the mental illnesses. Lobotomy is a surgical treatment that was done on the patients of mental illnesses who were unresponsive to the standard treatment. So lobotomy was done to treat people having depression, anxiety, schizophrenia, OCD, PTSD, psychosis, and so on. Lobotomy was performed in 1930s when these all mental asylums were overcrowded, jam-packed by these mentally ill women and men, and there was no space. And worst of all, there was no treatment for these mentally ill people. So they did not know what to do with them. So they started doing this lobotomy on them when these people were not responding to any standard treatment or therapy. Two ways of doing this lobotomy. The first is frontal lobotomy. Now, what is frontal lobotomy? In frontal lobotomy, the surgeon would drill a hole in the skull on the sides of a person, and from the sides, the ice picking stick would go inside, and there they would sever the connections of the brain. So this is how they used to do, by drilling the holes in the skull. My God, that's so scary. Okay, and then it was transorbital lobotomy. How this was done? This sounds even more scarier to me. Lobotomy, where a surgeon would put a stick, an eye stick, through the eye socket from here. You can see right here in the picture. Don't picture my eye here. So the eye stick would go through the eye socket, and it would go directly to the frontal lobe, to the brain. So this was even more scarier, but this is how it used to happen, and it actually did improve a lot of people's treatment to a lot of people, but we'll be talking about its side effects and how unethical it was. So you can see these two tools that are here, which used to be used by the surgeons. One looks like a hammer, and the other is like a like a stick, an eye stick kind of a thing that they used to poke. So one is hammer and another is just like a nail. So these were the tools used by the surgeons. So they would use this needle to prick in the eye socket, just imagine, and go right ahead in the frontal cortex of the brain. And there they used to, with the use of little hammer, pushing and all that, so that used to go inside till the brain. And there they used to sever it, or move it a little, where the connections in the frontal cortex. This was done so that any hyperactivity that is there in the person used to reduce by doing this, because the connections are severed altogether. There were a lot of people, thousands of people, who were treated with this kind of a surgery called as transorbital lobotomy. And the surgeries done on the brain are very, very risky, because a brain is a very sensitive, a very delicate organ, and can be damaged very easily, and often the damages are irreversible. So when lobotomy used to take place, there were a lot of side effects that used to happen, and these are some of the side effects: bleeding after the operation, brain infection, dementia, intellectual impairment, epilepsy, apathy, incontinence, obesity, and death was 2%. Lobotomy that was done on Rosemary Kennedy, the younger sister of the President John Kennedy, in 1941, to treat seizures and extreme shifts in her mood. So because of that, when lobotomy was done after the surgery, she was unable to walk and talk. She was permanently altered, left with physical disability. Antonio Icse and his colleague Almeida Lima are credited with the development of lobotomy in 1935. They promoted the frontal lobotomy across Europe and kept, keeping the poor patient records. There was lack of evidence, lack of effectiveness, but the surgery was conducted on thousands of patients. Neurologist Walter Freeman and surgeon James Watt, they championed the procedure in America, and they were influenced by an Italian colleague, Freeman, who eventually switched to the transorbital method, in which an ice pick-like instrument was inserted through the eye socket to reach the brain. So this was the dreadful one of the surgery that happened back in 1930s and 50s. So you must be thanking your stars that you were not born in that era, and you are right now here in this 2024. But you are not in that era anymore, and God spare us from the torture of lobotomy. And this is what the history of psychology and its treatment looks like. So let's get to the next part of it. So this was all about lobotomy. In our next class video, we'll be talking about different schools and how psychology evolved over a period of time. Don't forget to subscribe my channel, Sonia Psychology Classes, and know everything about psychology.